We're unique because we bring together all segments of the healthcare community. We have a mission that says we provide a united voice for people with chronic diseases and disabilities and their family caregivers. And the core membership are, I'm out of breath because I had an injury recently, and I tell you, sometimes I just start running out of breath, but I'm fine. The core membership is approximately 50 patient advocacy organizations, and it's important to know that they actually control the governance of the National Health Council. Our other members include nonprofit organizations that have an interest in health, professional and membership associations, and business and industry. So you can see that our membership includes organizations and companies that span the entire healthcare community. And while we're governed by the patient advocacy groups, what is very special about the National Health Council is that every member organization and company has meaningful ways that they can engage in the decision-making of the National Health Council. As you all know, the Affordable Care Act requires the Secretary of the Department of Health and Human Services to define the essential health benefits package that all of the health exchanges will be required to provide. Mandated benefits, as we all know, are not new, but they've most often been implemented at the state level. In addition, benefits mandated by states have typically been for discrete services or provider groups or patients. The federal essential health benefits package seeks to establish a new standard that will serve as a floor for more comprehensive benefits packages. Defining the essential health benefits package is one of the most important responsibilities we feel of the federal government in implementing the Affordable Care Act. The impact of EHBs on the approximately 133 million people that we represent who have at least one chronic condition is obvious. For the 40 million people with 3 or more chronic conditions, the impact is critical. Take, for example, the story of David Schur. David started having memory problems as well as trouble balancing and climbing. His family physician ordered a CT scan, which showed that the ventricles in his brain were enlarged with fluid, and I'm sure most of you know he wound up being diagnosed with hydrocephalus. That required him to have shunts implanted in his brain. He was also diagnosed with diabetes, and he's bipolar. And we know David, and he takes 12 to 13 medications daily. He has medical insurance, but he spent $11,000 last year in out-of-pocket costs for hospital and doctor bills, and another $5,000 or $6,000 for his medications. Allie Wolf has been struggling with debilitating symptoms that have left her in tremendous pain and with significant neurological conditions. She has been passed around from a general practitioner to a gastroenterologist to a gynecologist. She's had procedures ranging from colonoscopies to laparoscopies and been put on medications followed by other medications to help overcome the side effects of the original drugs. She was finally diagnosed with an autoimmune disorder, celiac disease. So how will the EHB package ensure that these patients and millions of others like them get the complicated care they need? If the Department of Health and Human Services creates a bare bones package of mandated health care services, people with chronic diseases and disabilities will not have access to the care that they require. If the package contains too many services, it will be way too expensive for patients that need the services. Patients with chronic conditions need to have their voices heard and their concerns clearly understood throughout the entire process as the federal government begins to develop and implement the Essential Health Benefits Package. So at the request of our member patient advocacy organizations, we undertook a comprehensive analysis of what a possible EHB package would look like, and then we commissioned an actuarial analysis. We held numerous meetings with representatives of the patient community, with policymakers, with industry representatives, because we believe that diverse stakeholders within the healthcare community need to work together to create a healthcare system that meets the needs of all people with chronic conditions. We then crafted proposed regulatory language that we'll be discussing in more detail later today. As you listen to the various experts and formulate in your mind how you might be advising the Secretary and her staff as they create the essential health benefits package, we ask you to keep your focus on the end user of our healthcare system, the patient. For it is individuals like David and Allie who will bear the impact of what is ultimately decided.